Hello dear viewers. Today we're going to talk about a breakfast that lowers blood sugar. I'll show you from my clinical practice. Today I had two patients during my appointments, a man and a woman, both of whom have had diabetes for 5 years. Up until today, they hadn't taken any blood sugar lowering pills, hadn't followed a diet, and hadn't exercised. Let me show you now. Here is the woman. Her fasting blood glucose in the morning was 8.7 millimoles per liter. Our lab measures blood sugar in millimoles per liter. Her glycated hemoglobin was 6.8%. After breakfast time, by the way, I'll show you what breakfast she had in a moment. After eating, her blood glucose actually dropped to 7.8 millimoles per liter. Now, let me show you and give you a second example. Here is our second patient. His fasting blood glucose in the morning was 14.5 millimoles per liter. After breakfast, 2 hours later, it became 13. As you can see, after breakfast, their blood sugar did not rise. On the contrary, it dropped by 1 in the first case and by 1.5 millimoles per liter in the second case. So what did they have for breakfast? Our first patient ate 2 fried eggs, and our second patient had cauliflower and 4 fried eggs. Why didn't their blood sugar go up? I'll show you now. So, cauliflower. Per 100 grams, cauliflower contains 5 grams of carbohydrates, of which 3 grams are complex carbohydrates and 2 grams are fiber. And out of the complex carbohydrates, 2 grams are sugar, glucose. So, because there are so few carbohydrates in cauliflower, eating it doesn't raise your blood sugar. Now, let's talk about fried eggs. If you eat 2 fried eggs, your body will get only 1 gram of carbohydrates, 13 grams of protein, and 14 grams of fat. And if you eat 4 fried eggs, then you'll get 27 grams of fat, 2 grams of carbohydrates, and 25 grams of protein. This is an example from the keto diet. Because of the low carbohydrate and glucose content in these foods, our patient's blood sugar did not rise. And that's just from one breakfast. Just imagine if every day your blood glucose keeps dropping by 1 millimole per liter. So we constantly add fried or boiled eggs to our diet. You can eat them fried or boiled. It doesn't matter. The main thing is that your blood sugar doesn't go up, but goes down. And that's just with one breakfast. If you subscribe, I will show you dishes every time that don't raise your blood sugar and will help you achieve clinical remission of diabetes. See you soon, friends.